Great. Well, thank you and for everybody for the opportunity to present to you some of the work that's been happening at the Brant Community Healthcare System over the last few years, as well with a look to the future in terms of what's in store for us as a community as the hospital moves forward with redevelopment. So I just wanted to thank you all for the opportunity today to present. So maybe where I'll start is the strategic plan that we developed initially in 2019. So in 2019, the Brant Community Healthcare System undertook the process of developing a strategic plan. That strategic plan was overseen by a committee of about 33 members, both internal members to the organization, but external members as well and partners, including municipal leadership that was involved in the development of the strategic plan. So this was not a strategic plan that was developed in the office of the CEO. We had over 1,400 contact points, either individuals or groups, as we were going through the strategic plan process. It started in April 2019, and we went through a series of phases from preparation, discovery, analysis and synthesis to the validation. And finally, 1 week before the announcement of a worldwide pandemic, we launched our strategic plan for the Brant Community Healthcare System. The vision that the steering committee developed, and it was very insightful and at the time, and it was, really we didn't know what the future held, but they said, exceptional care can only happen with exceptional people. So the idea was that, if we have the people and we develop those people, then, the result will be and the outcome will be exceptional care for those that we serve. We didn't really have any foreshadowing of the health human resource challenges that we now face as a healthcare system. So this vision today speaks still very strongly that, if we do not have the people, you cannot deliver healthcare. And it is the people. So that is and remains strongly our vision. The mission of the organization recognized that, as a hospital, we can't be an island. So our purpose for being was really to work together to build a healthier community. And that working together included both our healthcare partners, and we've started to see that as we've moved forward with the Ontario Health Team, but in particular as well, our patients and our families. So one of the things that we've developed early on is what we call the CEO Patient Family Advisory Committee. And we now have patient advisors pretty much on all hospital-based decision-making committees within the organization. They sit on the quality committee of the board, and on a monthly meeting, we do have a CEO Patient Family Advisory Committee. So an offer for anybody that would like to be engaged as a patient family advisor. We would love that opportunity to have your voice as part of our organization. And our values are really about how we deliver care. And I always say to all new staff coming into the organizations, our values are pretty easy to remember. If you can remember the acronym CARE, you can probably remember our values. And they're based on compassion, accountability, respect, and equity. One of the things that I always talk about with our new staff that are coming into the organization is the clinical benefits of compassion. There's well-documented empirical research that shows that where patients receive compassionate care, their clinical outcomes actually improve. I also talk about that within the context of an organization, and really saying that if we're compassionate with one another, it really actually makes it a really nice place to work. And that's easier said than achieved, but it is still a value that we really espouse to. The other values that, the accountability and the respect, I think, where those are pretty straightforward in terms of what we mean by them. But the whole issue of equity was something new as well. That again, prior to the pandemic, equity or social accountability for organizations was a rather unique positioning or perspective. And our equity work has focused primarily on improving the cultural safety of care for Indigenous populations and for Indigenous staff that work at the Brant Community Healthcare System, And we're now moving on to broader equity issues as it relates to the broader social determinants of health that many populations face. So those were, the mission, the vision, and the values of the organization. I'm not going to go through a lot of detail on each one of the key goals, but we had 5 key goals that are driving the work now within our organization: advancing quality and safety, partnering to transform care. Talked a little bit about that already. Support and empowering our people. So a lot around the recruitment, wellness of our staff and physicians, building sustainability, and that's where most of my presentation will focus on, particularly as we talk about improving the financial sustainability of the organization. And we've significantly improved the financial sustainability of the organization, but also modernizing our technology and infrastructure. And then, as I've mentioned, championing health equity. We also had to do all of this work, as I said, when we were faced with a pandemic. So as we were developing our strategic plan and implementing our strategic plan, we also had to deal with a whole bunch of new things that were thrown at us around testing and assessment, around building capacity to support the community during the pandemic, supporting patients in other settings, in congregate settings. Our organizations was involved in that with our partners in our OHT. Dealing with new supply equipment challenges, new challenges related to infection prevention and control, and then of course promoting health, and particularly with a focus on immunization that was thrown at us in terms of the COVID response. I'm just going to talk really briefly at a high level about some of the key goals and the work that's associated with those key goals. The first one was around advancing quality and safety. And here the focus has been on really improving our patient flow and our transitions from the hospital, making sure that we continue to work to improve the connections in care. And this is a really difficult challenge, particularly as today when we face health human resource shortages with many of our partners and internally within the organization. Creating a culture of patient safety. So, really focusing on a just culture framework within our organization, encouraging reporting, making sure we had those systems in place of reporting, and always looking at things from a patient safety perspective. We also measure our culture of patient safety on a regular basis. We're measuring that pretty much every quarter and reporting on that to the broader organization. Of course, measuring and improving the patient experience and always being accreditation ready. We are fully accredited and we are preparing for our next accreditation in November. As I said, the second key goal was to partner to transform care, and the patient family engagement is, we've advanced that work very significantly in the last 4 years, and always looking for opportunities to engage patients and families. So again, if you're interested, please let me know. Supporting the Ontario Health Team is work that we've been focused in on. Our Director of Integration and Planning has been seconded to really be the director of the OHT, and we support that position financially. But the reporting of that position actually reports to the co-chairs of the OHT. Then strengthening regional partnerships to ensure that patients that might present to the Brant Community Healthcare System that require advanced care have a smooth pathway to get to our regional programs for cancer, cardiac care, neurosurgery, thoracic surgery, etc. As I said, a big focus has been on supporting and empowering our people, really looking at the recognition of people, making sure that we create safe work environments, recruiting and retaining our workforce, and making sure that we have a workforce that is representative of our population, and promoting employee wellness. And as I talked about in the introduction, around championing health equity was really, our work has been focused on strengthening our relationships with our local Indigenous communities, making sure that the care that we provide is culturally safe and recognizes the diversity of our population. And The priority populations that we focused on through the last few years have been children. So we've made some significant changes in the care for our pediatric population. We now have a pediatric acute care referral service. I'll talk a little bit about that as we go through the presentation. For seniors, we now have a geriatric service within the organization that provides inpatient geriatric care, but is also partnered with our regional geriatric program, outpatient program, and a significant focus on mental health and addictions. Probably what most people are interested in is the key goal around building sustainability, and that included, implementing and building an infrastructure renewal plan for the hospital, looking at the emergency department and the overall hospital redevelopment as the main areas of redevelopment within our organization. But we've also had a significant focus on implementing capital equipment that was very old and moving forward with a second CT scanner, which will be up and operational this summer. But this year, for example, we've made over a $10 million investment in renewing our medical imaging or diagnostic imaging equipment. Achieving financial sustainability to do all of this was, of course, required. When I came to the organization, it hadn't ran a balanced position for, I think it was 7 or 8 years, and it had what we call a working capital deficit of about $28 million. What that really means is, in practical terms, we had to go to the bank to get a line of credit to pay for staff and all of the organization expenses for about the last 4 months of every fiscal year, so that by the end of the fiscal year, we were running probably about a $30 million line of credit. We've eliminated the need to do that. And finally, really to renew and build our digital infrastructure so that it is modernized. And we are in the position now to make the vendor selection for moving forward with a modernized record. Of course, I think what most people are wanting to understand is where are we in the overall hospital redevelopment? And this is a nice conceptual picture. It's not what the final building will look like, but it's really to convey that what we'll have is a new modernized facility as we move forward with the planning of our new hospital. Just so you understand, the ministry has a complicated process of planning as we do redevelopment of any kind within the hospital sector. You see on the far left, you'll see a pre-capital submission, Part A and Part B, and then you will see a Stage 1 proposal, Part A and Part B, and you will see that requires government approval to plan. So what we had announced in March of 2022 was the government approving what we had submitted to government in our pre-capital submission, with them saying, yes, you now have permission to plan for a hospital. Why that's important is because government has to set aside the money, that money that they will know will be expended in the future. So what it means is the money for the redevelopment of the Brant Community Healthcare System, which was preliminarily identified as $1.3 billion expenses, has now been set aside. And if you go to list on the government website on Ontario Infrastructure Ontario, you will see the Brant Community Healthcare System listed as a future project for the ministry to invest in. We are approved to do Stage 1 and Stage 2 of planning. And we will then make that submission to the Ministry of Health. The bureaucracy can approve us to move forward to Stage 3. But to do Stage 4 planning really means that we're now putting up together detailed what we call construction documents and documents that will eventually go out to tender. And to get to that next stage is the next time we will require approval from government. So we will be able to advance right to the end of Stage 3 in probably over the next 2.5 years. And then we will have to work with government to getting to the Stage 4 approval. So that'll be the next big challenge for the community, where some advocacy may be required. I'm just going to talk a little bit about our emergency department, because we are going to tender our emergency department Stage 1. So everything that you see in gray on this slide is our existing emergency department. Project one of our emergency department, which I said will be tendered probably the next couple of weeks, well, before the end of the month, is all of the colored areas that you see on this slide. So this is going to be growth, total new space for our emergency department. We will then have to do project two, which is, you can now see there's a lot more color there, and that's really getting into our existing emergency department and modernizing that. So essentially, emergency department will be twice the size. It will be fully modernized once we get through all of the construction. This is complicated construction. We're working in an existing facility, so there's multiple phases to move this this construction forward. So it'll probably take us 2.5, 3 years just to get even just through the emergency department, because we can't just simply say we're not going to provide patient care anymore in the emerge and close the entire thing down and get it done. We have to do it piece by piece. As I've said, we've made an investment of about $10 million in the last year in our medical imaging equipment. We have a new CT scanner, a second CT scanner, and that construction, as supply chain goes, we couldn't get lead line doors, so it delayed it a bit. We will be up and operational with our second CT in the summer. We've got now three new X-ray rooms and an interventional suite at the Brantford site, a new X-ray room at the Willett site, and another under smaller pieces of equipment that are in progress. So we're really modernizing our medical imaging equipment. As I said, pediatrics was a priority population for us, and we have two new services that over the last few years we've introduced. We call them pediatric quick care and acute care referral service. The ideas of both of these services is for patients, young children or children that present to the emergency department, there is an opportunity to move and flow these patients up onto a clinic within the hospital so that we can provide them to, age-appropriate care in a much more expedited way. As well, this service also provides the opportunity for family physicians to refer children into the hospital and not having them come through the ED, but just having them be referred to the clinic for immediate assessment. We're actually modernizing the space because we've just used the existing space, but we are undertaking a construction project, and that project is kicked off, and we should be completed all this work by April to create appropriate space for this clinic, and it will be much more patient friendly, child friendly, and hopefully the patient experience will be significantly improved. So as I said, for their hospital redevelopment, what are we doing in stage one and stage two of our hospital redevelopment? So essentially what happens in stage one and stage two of the hospital redevelopment is that we have to detail every room location within the facility based on looking forward at the population and what the population in Brantford and surrounding area will look like 25 to 30 years from now. So it's that 25 to 30 year vision that we use to start to detail what the service levels will be that we will require, the services that will need to be within that building, the space requirements, the beds that will be required in that building as we have that 25 to 30 year time planning horizon. And then we actually have to do estimates of how much it's going to cost to operate that facility, as well as what it's going to cost to build that facility. We then have to detail it, locate that facility on the site, start to look at the interrelationship of the spaces within that facility, and then determine what of the old facility will remain and what of the old facility will be salvaged and renovated, and how all of that stuff gets connected together. So that's really what happens at stage one and two. It's fairly detailed planning. By the end of stage two, we will know all of that information. We're getting pretty actually close to knowing most of that information right now in stage one. So as I said, initially we had planned when we did our pre-capital submission that the new tower that we're rebuilding would have about 440 new beds. That now number has gone up a bit. So will the price tag go up a bit as we do the cost estimates, because we are going to have a bigger, require a bigger facility than when we initially planned this back in 2020 because of population growth, because of population aging as well, and taking all of that into account. We always have to base our planning projections on the Ministry of Health or Ministry of Finance population projection. As I've said, the hospital will be located on the existing site. You can see a nice picture of the existing site in the upper left-hand side of your screen. In the lower left-hand side of the screen, it's really looking at the location. This is the existing site is an ideal location in terms of our transportation access points, its location and adjacent to downtown. Not all of those buildings will continue to be on site. There will be some demolition of existing buildings to make room for new. You'll see the Willett site up there, and the Willett site is part of the redevelopment process. The Willett site will be modernized as well. For sure, the expansion won't be as big, but we will be continuing to have bedded capacity at the Willett site. The urgent care center will be modernized. As well, we will be putting some additional outpatient services at the Willett site, like dialysis. You can see this is a rather high-level architectural schematic of, the building and the location on the site. Anything that's blue that you see is going to be retained. Anything kind of that block in orange represents the mass of the new building. So you can see it's a pretty substantive new building. And anything that you see sort of dotted out in white is demolition that will occur to enhance the site. This is another schematic looking at it in a different way. You can see St. Paul Avenue on the left-hand side of all of that building mass, but the red buildings are the existing building that are retained, and the new hospital and connection you can see from the new to the old that occurs. And yes, we are contemplating closing terrace retail and redirecting the traffic in other ways. So that is work that we're doing right now with the city. So at the end of the day, what we will have is a new modern hospital that will service well the needs of the community well into the future, well into the next 100 years, and will have the ability to grow and adapt for the community needs. And with that, I hope I haven't gone too quickly and haven't provided you too much information, but I would be happy to answer any questions that you might have, any points of clarification, and any advice or dialogue that we might have related to this. So I will stop sharing my screen now.
Thanks, David. And we do